Welcome back. We are in the middle of Black Maternal Awareness Week, and here with me now, ensuring moms thrive from bump to beyond, are Luann and Yvonne. Hi, ladies. Thank you so much for coming in.
Hi,
Hi,
thank
how
you
are
for
you?
having us.
Why don't you start off by talking about the two different organizations you guys are with and about each and everything you do for our community?
Sure. So I'm with Child and Family Services. I'm the Chief Equity and Inclusion Officer. And Child and Family Services is an incredible organization that is just doing such a diverse array of programs. So we have foster care, we have residential care for children, we have a counseling program that is really thriving. We have the Center for Resolution and Justice. We have an EAP program, and our counseling program. A part of the counselors there have been specifically trained in prenatal, perinatal mental health, and so we're here to talk about that today.
Alrighty.
So Buffalo Prenatal Perinatal Network, we've been around for over 30 years, and we work with pregnant and parenting moms in their homes. We're a home visiting service. So we engage with pregnant moms, parenting moms. We do education, advocacy with them. They can stay with us for 2 to 5 years and trying to reach them to the next level. And we also have a fatherhood program. We work primarily on the east and west side of Buffalo, primarily with African American and Hispanic moms.
Why is maternal wellness such an important to raise awareness for?
So many reasons. So I don't think the experience of maternal health is talked about enough. There are so many women that experience, and men, that experience depression and anxiety. What we know is that 1 in 7 women and 1 in 10 men, and those are just the reported numbers, will suffer from postpartum anxiety and or depression in that first year after the birth of a baby. We know that that number is likely much higher for communities of color, and this is what impacts that first year and those early years of a child's life. And so it's just so vitally important to talk about the ways that we as a society can support these new parents as they transition into familyhood.
I'm glad you talk about that. Do you want to explain to us the race disparity in regards to mental health and some contributing factors, for maternal health?
Yeah. So it's very well documented that with maternal health issues, Black women are 1 to 5 times higher than white women. And with mental health, it's the same. They're 40% higher. And again, those are the ones that are reported. Some people don't get screened, some people don't get treated. And as Yvonne said, that mental health sets the basis for that mom and that child for the rest of their lives. And it can have long-ranging impact if it's not dealt with when it happens. So that's why it's so important.
Can you tell us about postpartum health and wellness and the struggles women commonly face in their mental health?
Yeah, so I gave birth to my beautiful baby boy, EJ, in 2014. And as a licensed mental health professional, I knew all of the ways to prepare. I had read all the baby books. I had taken all the classes. This was very much a welcomed, loved, and wanted baby. And I was still just so surprised by the freight train of anxious runaway thoughts, of concern for care for my child, the constant sadness that seemed to be my companion in those early months when society tells us this is supposed to be the happiest time of our lives. And that struggle felt really isolating. I felt that loss of community. And as a mental health professional, I know that so many other birthing people and new families share that struggle and that experience. And it's compounded by the fact that many women feel pressure to return to work early from maternity leave, or they may not have a maternity leave at all. And so it really makes the possibility of progress feel impossible. And we know that Black and brown women really, that struggle is even greater for them.
Right. And there's still the stigma with mental health, and especially with women of color. They're very fearful that someone's going to take the baby away if they admit to anything. So you really have to meet them where they are, We definitely need more providers of color. I mean, my clients say it all the time to me. They want to talk to somebody that looks like them. So I think that it's a huge issue. I mean, it's actually overtaken, when you look at the causes of maternal mortality, it's overtaken maternal hemorrhage between mental health and overdoses. It's higher right now with women. So it's a huge issue.
So what are some of the resources out there for those new and expecting moms?
Well, Child and Family Services, as I mentioned earlier, has counselors who are specifically trained in prenatal and perinatal mental health. And we actually have a wealth of resources on counselors who are trained in prenatal and perinatal mental health. And I think that's what's most important to remember is when families are seeking help, seek out counselors who are specifically trained in this particular kind of mental health so that they can get the support and the care that they need and deserve.
And we actually partner with Child and Family Services. We screen all our moms for depression, substance abuse, and domestic violence. And several years ago, we had a large number of our moms that were testing positive for depression, but again, they don't want to go to a counselor. So we partner, and actually Child and Family Services is running a group for our moms now at the agency for our moms that are experiencing issues. And it's a small group, and they teach them strategies, but it also, our goal is to get them to individual counseling, and it's been very successful. And I think that there's counselors in the community, but Child and Family, their staff is trained specifically with this population.
Ladies, thank you so much for coming in and sharing more about what you do. And viewers, if you are a mom, a new mom expecting, there are things that you could be facing that you don't have to face alone. There are resources available for you, and you can see them right there at the links on your screen. So thanks again for coming in, ladies.
Thank you so much.
Thank you.